uveitis is the inflammation of the uveal tract. Uveal tract is a part of the eye that includes the brown part of your eye, that is the iris, and the central part what is called the ciliary body, and back what is called the choroid. So all these three part of the structure of the eye called the uvea, and inflammation of this uvea is called uveitis. Uveitis can occur in any age group. You can have it in youngsters, in small children, you can have it in teenage, you can have it in older age group. So in any age group uveitis can come, and uveitis can come in various forms. The front part of the eye, when it is involved, it is called anterior uveitis. When the middle is involved, it is called intermediate, and when the posterior part is involved, it is called posterior uveitis. It can also involve all three parts, case it is called pan uveitis. So in various forms and in various age groups uveitis can occur. Because it is so varied that uveitis is, the presentation can also be very varied. So commonly the anterior uveitis, what we say when the iris gets inflamed, it is very symptomatic and it causes pain in and around the eye, especially inside the eye, and it can cause photophobia or difficulty to look at light, and it can cause redness, which is redness usually without discharge. In conjunctivitis you will get diffuse redness with discharge. Here there will not be much discharge, but there will be pain, redness and photophobia. This is the classical triad of anterior uveitis. In intermediate uveitis, or when the central portion, the ciliary body is involved, the common symptom is decrease in vision and also floaters. Because that vitreous is inflamed, you will get a lot of black spots in your eye. So that is one of the symptoms of intermediate uveitis. When the choroid and the retina are involved, it usually presents both with the black spots and a grossly decrease in vision. So that is the usual presentation. There may not be much pain or photophobia when the posterior part is involved. But in some subset of people it can be asymptomatic also, what we call chronic granulomatous causes. In those conditions it may be asymptomatic in the beginning, and then it will cause a decrease in vision later on as the complications set in. Depending on the age group, there are a lot of causes for uveitis. You can have infective causes where there is a particular organism that is responsible for the uveitis, and sometimes you can have non-infective uveitis where there is only some other mechanism that is involved in making this disease. When it is infective cause, we commonly consider conditions, parasitic infections like toxoplasmosis. You can have granulomatous conditions like tuberculosis, sometimes syphilis. So these are the common infective causes. The non-infective causes are usually autoimmune in nature. So autoimmune conditions are conditions in which your protective mechanism of the body is acting against the tissues of the body. So it can be autoimmune in nature. In addition to this, there are a lot of systemic diseases that can be associated with uveitis, which include sarcoidosis, then juvenile idiopathic arthritis. So the cause for uveitis is so varied that it needs a tailor-made investigation for each patient depending on the age group, the type of uveitis, the onset of uveitis, and the findings that are seen on clinical examination. Pediatric uveitis differs in a lot of ways from adult uveitis, but the most important difference is that it is completely asymptomatic in majority of the pediatric patients. Asymptomatic means they will not have any pain, redness or photophobia. They will discover that there is decreased vision, sometimes on their own in their older children, but in younger children they might be discovered only on a routine investigation. When you are taking the child for an eye checkup, you may find out that the one eye has decreased vision, and that is because of uveitis. This is because the uveitis in children is a very slow smoldering kind of disease, and it causes complications in the long run, which then brings it to our notice. Unfortunately, this is the major difference. The other difference is that pediatric uveitis is almost always associated with some systemic condition. Adult uveitis may be just eye involvement alone without any systemic problem, but pediatric uveitis definitely warrants that the child be investigated for other systemic disorders. Along with this, another thing that should be kept in mind is what we call masquerades. Masquerade means some kind of tumor inside the child's eye that is showing signs that are similar to uveitis. So in pediatric uveitis, when we investigate, we always keep that also in mind. because the cause and the age group of uveitis is so varied, the investigations will also be varied and tailor-made depending on the type of uveitis that you have. So your doctor is the best judge to tell you what kind of investigations you require for finding out the cause. But on the other hand, to find out how much the eye is involved, you will require first a slit lamp examination to look at the findings in the front part of the eye, and then a dilated retinal examination to look at the back part of the eye. After this, if required, if the back part of the eye is involved, you may be asked to do an fundus fluorescein angiogram, which will look at the blood flow and if there are any inflammations in the blood vessels or in the retina and choroid. You will also be asked to do an OCT or a scan of the retina to look at how much swelling is there. Sometimes you may be asked to do an ultrasound scan, which will tell us further to the back of the retina any involvement is there and if there is any fluid. Ultrasound can also help to eliminate whether there is any tumor causing this masquerade uveitis. So these are the usual investigations. The cause, usually you will require a set of blood tests that your doctor will tell you depending on the type of uveitis that you have. Again, because the causes of uveitis and the age groups are so different, the treatment can also differ. So if it is an infective cause of uveitis, you will require specific treatment for that infective agent. If it is tuberculosis, you will require anti-tubercular treatment. If it is toxoplasmosis, you will require anti-toxoplasma treatment. But along with this, one of the mainstay of treatment that we have for uveitis is steroids. Even if it is an infective cause, you may require steroids to suppress the inflammation in the eye. If it is a non-infective cause, for sure the first line of management is going to be either topical steroids as drops or systemic steroids as tablets. When it is very severe, you may even require injection steroids. But steroids have a lot of long-term problems and they can cause your diabetes to be uncontrolled. They can cause cataract and glaucoma in the eye. Therefore, we cannot use steroids for a long time. So if your uveitis requires immunosuppression for a long time, we usually advise using other immunosuppressive agents or disease modifying agents, and we usually treat the uveitis in conjunction with either a rheumatologist or a physician who can help monitor the side effects of these drugs. But you will require long-term treatment to keep your disease under control. And for children especially, when they have pediatric uveitis, often the mainstay of treatment is systemic immunosuppression and not drops. So drops are used only for a short period, and systemic steroid plus other immunosuppressive drugs are used for a longer period to get the disease under control. In addition to this, you may require treatment for your complications. For example, you develop what is called a complicated cataract. Secondary to the uveitis, you have developed a cataract. You will require cataract surgery for that. If you have developed a glaucoma, you will require drops to control your glaucoma, or you may even require surgery for glaucoma. So the entire gamut of treatment will depend on how much it has affected the eye and what complications it has produced in the eye. This will again depend on what kind of uveitis you have, but the majority of them, except the infective ones, which are usually well controlled with anti-infective agents, majority of the autoimmune type of uveitis will require long-term treatment. But there are some uveitis like post-operative uveitis, which will probably be controlled with a very short course of steroids. But other conditions, like if you have, because of an underlying systemic disorder, some other underlying autoimmune disorder, if you have a pediatric uveitis, it is very likely that you will need a long-term immunosuppression with good monitoring of the eye part by an ophthalmologist or a uveitis specialist, and the systemic part by either a rheumatologist, pediatrician or physician. The uveitis is a group of diseases that can cause a lot of complications in the eye, and if left untreated, it can cause complete loss of vision in the eye, as well as what we call ptysical eye, which means the eye will become shrunken and atrophic, and it can lead to that. So it is very important that uveitis is detected early and appropriate treatment given at the appropriate time, and the complications also need to be managed as and when it occurs. If left untreated, especially in children, it can cause complete loss of vision, and beyond a particular stage, if the uveitis is allowed to progress and it causes hypotony where the pressure of the eye is very less, then it becomes more and more difficult to treat the uveitis.